Hi, everyone. Thank you for giving me the opportunity to talk about a recent research project that myself and Dr. Schumacher completed, which was a result from the READS grant that was finished in February of 2024. My name is Krista Dawdy. I'm the clinical educator in radiation therapy, and I work alongside with Dr. Eva Schumacher. I think you all will know her. She's recently retired from Sunnybrook, but I was really happy that we could complete this project together. She's been a wonderful mentor to myself. I was the co-director on this series with her. And I also want to take a moment to thank all our contributors. Without their support and time, we wouldn't have been able to make this such a successful webinar series. And also a very big thank you to AACE for the READS grant support. Without this funding, this project would not have at all been feasible, and we really appreciate your support of the project. I'll just highlight the learning objectives of our project. It was to evaluate the feasibility and efficacy of the 6-month professional education program on modern radiation techniques for the care of older adults with cancer. Secondary objectives were disseminate evidence-based information on modern radiation technologies, engage participants from an interdisciplinary background to share their knowledge and experiences regarding the treatment of older adults with cancer, and also finally just to evaluate the webinar course content, format, and efficacy of the sessions. The webinar successfully met its primary objective by providing healthcare professionals with valuable updates on modern radiation oncology techniques. We had a variety of different professionals, as well as patient and caregivers in each of the webinar sessions. Overall, we had 25 evaluations completed over the six sessions. I will use the information learned in my practice. We received 4.9 out of 5. And just to highlight, the program met my expectations most strongly or somewhat agreed, as well as the program was relevant to my discipline and profession. And that as well was somewhat agree and strongly agree of each of the overall sessions, which was great. We received very positive feedback. The patient experience provided the biggest impact of all throughout the webinar series. To hear their stories and journeys was very impactful. We did have some challenges. Most of the grant was used to provide a platform for the webinar series. The participant cost was free, and in hindsight, by doing that, I think if we had charged maybe a nominal fee, we would have received more buy-in from each of the participants. As a total of 47 registrants, we had a total of 47 registrants for each of the webinar series. And you can see from, we had a wide variety of participation throughout, but it definitely declined from the first session to the last session, which was really unfortunate. So just to highlight some of the lessons learned and just a summary, the grant provided an opportunity to learn from the different professions all over the world. We did have some professionals worldwide. The patient story was very impactful, not only to myself, but also all the participants. Some of the comments we received was very impactful and insightful, and we really appreciated listening to their stories. It really made me rethink geriatric care and radiation treatment, and also even the word geriatric. I never really thought of it as a negative connotation, but we did have one patient participant who really did not want to be thought of as a geriatric. They were over the age of 70, but were living a very full and busy life, and they didn't see themselves as geriatric at all. So it really made me rethink how I thought of that term, but also like how I would explain it, and also how I use it in my practice as well as an educator. Also lessons learned in developing the webinar series and how to better engage participants. I was really highlighted the work that went in and how to get everyone organized, and we really had a lot of support from the University of Toronto CPD office. But I think, to better engage participants, maybe not have it over a longer period of time. I don't think from November to February we sort of lost momentum, and would have, it was unfortunate because the webinar series as a whole really, although they were individual, they really sort of highlighted a lot of key important points over the course of the 6 sessions. So probably to do it differently, we should have been charged maybe a nominal fee and a shorter timeline. Just thank you very much for your time, and we really again appreciate your support for the with the Reeds grant, and look forward to hopefully again being able to do something like this. Thank you.